Welcome to Mom Matters. I'm your host, Alyssa Dver, and in the next 10 easy-to-watch minutes, we're going to give you practical tips for more productive parenting. We're talking today about the truth around cough and cold medicines for children. And very important topic. There's been a lot of information in the news, so we're very grateful that you're joining us today. This is Dr. Heather Diskin. She's a primary care physician in the Natick, Massachusetts area. I know that you're a recent graduate of the program here at MassGeneral Hospital for Children. So a plethora of information on this, and I appreciate you being here today.
Great, I'm really excited. Thanks so much for having me.
I think it was about a year ago that the meds were pulled off the shelves, so at least tell me what happened and what's going on.
Sure. I think pediatricians have had concerns about these cough and cold medications in young children for a long time. So we were actually really happy when the FDA went ahead and took them off the shelves, because that just really backed up what we've been talking about for a long time. The main concerns in the age group under 2 years old were that they were actually potentially getting too much of certain medications and having some side effects, and on the other hand, not really getting any benefit from it at all, which was obviously what the parents were trying to do.
Now, what kind of side effects are you talking about?
So most of the medications came in the form of either kind of a Tylenol cough and cold or a Motrin cough and cold, and pediatricians still very much recommend both Tylenol and Motrin when given correctly for things like fever and pain. However, when you put the combination cough and cold medications in, you're kind of adding another medication, and some people also don't realize that those meds have some of the same ingredients. So if they were getting both medications at the same time, there was a lot of risk for overdose.
So if you're giving your child Tylenol as Tylenol, and then Tylenol cold and cough, you're double dosing the Tylenol.
Exactly.
Okay.
And then that can lead to things like liver toxicity, and then some of the cold remedies can lead to things like a fast heart rate, which can be detrimental as well.
Absolutely. It could be not so good when you're trying to calm your kid down.
Exactly.
So these medications, are they still off the shelves?
They are still off the shelves in the infant formulations, which again is that age group under 2. There are still children formulations for kids from the ages of 2 to 11. Pediatricians are still trying relatively hard to recommend against them to parents, but sometimes, we understand that people are just at a loss and no one likes to see their kid feeling ill, getting them to school okay. So, we understand that people do want to try things, but what we really say is if you're not seeing an effect, don't give them something they don't need.
And is it typical that they're not effective?
We don't usually get a lot of positive reports that things are helping.
Okay.
Sometimes we say, as long as we're okaying the dose and that they're doing everything correctly so they're not overdosing anybody, if you get an effect, great. If not, just back off. But really we don't see, it's a cold virus and you're not treating the virus, the cause itself. It has to run its course. And the relief really doesn't last very long, if there's any at all.
Okay. Well, I know that you have some ideas that we're going to share with our viewers about effective ways that, at least as a mom, we can make ourselves feel better. I don't know if they all work for their kids, but we're going to take a break now, and when we come back, we will talk about some of these chicken soup-like remedies that are non-medical, non-medicine oriented that may or may not work for you and your kids. So we'll be right back.
Great.
ProductiveParenting.com provides parents with high-quality activities developed by experts in early childhood development that lay the foundation for future learning and enrich the relationship with your child. We believe your children are precious, and so is your time. That's why we've simplified the search for quality activities by providing members with a personalized homepage, updated daily with a new activity idea for each of your children. Stop searching and start playing. Visit www.productiveparenting.com today.
Welcome back to Mom Matters. We're here talking with Dr. Diskin about cold and cough medications, pediatric cold and cough medications specifically. So I mentioned chicken soup. I know it's one of my favorite remedies. But what are the things that we can do for our kids that actually are benign, that won't hurt them in any way, but certainly may actually help?
Right. So unfortunately there aren't so many options, and everybody responds differently to different things. Overall, the topic that we're talking about mostly concerns viral illnesses that do eventually run their course, which is hard because everybody wants their kids to feel good, wants them to be able to go to daycare and school, and that's understandable.
And wants everybody to sleep.
Exactly, and sleep for sure. I think that's one of the main reasons kids end up coming to the office, is because parents can't get any sleep at night when their kids don't feel good. So some of the remedies that can be helpful but are not surefire because that virus, again, still needs to run its course, A lot of people will have some luck elevating the and again, we still don't want to put anything in the crib with the young infants, but elevating the head of the bed by putting something underneath it can just, gravity runs its course and let some of those secretions drain out. Saline or saltwater drops to the nose can also be helpful, especially in real small infants, because they're so congested. Sometimes they even have difficulty with their feeding, which is really frustrating and scary, both for kids and for parents. It sometimes drives them a little bit crazy if you're using the bulb syringe, but if you kind of clean them out right before feeding, they'll really be able to breathe through their nose and do a lot better with that.
Yeah, and eating is a good thing when
exactly. And kids, their appetite really decreases when they're sick anyway, and then on top of that, if they're not able to physically kind of coordinate breathing and eating, it's kind of a double whammy. It makes it a lot harder.
Right.
For older kids, when you're not necessarily using the saline drops in the nose, just having a dehumidifier or taking them into the bathroom with a steamy shower, things like that can just help to loosen up all of those secretions as well.
Okay, vapor rubs, anything like that that you recommend?
Some people have some success. I would say, again, maybe more in the toddler age, or at least to probably talk about your pediatrician with it first. Because you don't really want to overdo anything, because some of those are relatively strong. But
okay, and in general, homeopathic solutions maybe work for some people, maybe not. It can cost a lot of money. It's up to the individual.
Sure. One of the more natural remedies that has had a lot of talk, both in journals of pediatrics and in the media, at the time that all of this happened, was using honey for cough. They have done some excellent reports about it and shown that it is somewhat effective. The caveat to that is that we never recommend honey in children under the age of 1 due to the risk of botulism.
Right.
So still no honey at all under the age of 1, but some people do have better luck with their kids sleeping through the night in the setting of a cough if they have a little bit of honey before bedtime.
Oh, that's good to know.
Yeah.
Excellent. Other places, resources on the web, books, other things that you can recommend for people to get more information if they want to know more?
Sure. I think the internet is a wonderful resource that we all have, but sometimes there's more bad information on it than good. People get a lot of anxiety from looking up things on the internet as well.
Drives doctors crazy, I hear.
Exactly. But it's great that people are taking that first step on their own for sure. The Academy of Pediatrics, the American Academy of Pediatrics website, which is aap.org, does have some helpful information and a lot of up-to-the-date topics, as well as the FDA.gov website has a little bit of information on what we talked about in the first segment of the show. And other than that, your pediatrician and the nurses at the office are a great resource, and I think our main role is to just give a lot of reassurance, because these are a fact of life, especially in the first few years of life, and they do usually run their course.
So my last question is, if your kid is sniffling, sneezing, do you bring him to the doctor, or do you wait, or what's the line there?
Right. I think if your child has at least some part of the day where they're looking like the kid that you know, having some smiles, eating and drinking, staying hydrated, with a cough and a cold and feeling miserable part of the day, that's okay. They just have to kind of look like the kid that you know and love for part of the time, and if you're just totally out of whack and nervous about anything, just go ahead and make that call.
Fair enough. Well, thank you so much for joining us today. I know
You're
it's
welcome.
one of the things that as parents we worry about a lot.
Yes, understandable.
But hopefully less so now with the information. So thanks so much. Thank you to our viewers for joining us. Definitely look at our website, which is mom-matters.com. You'll see our previous shows all posted there, as well as information on upcoming shows. This is Alyssa Dver from Mom Matters, giving you practical tips for more productive parenting.